There are 5 main stages of grief. Although everybody reacts to trauma and grief differently, there are 5 main pillars that we all similarly go through. To remember them, remember that death always brings great acceptance. D for denial, and this is often our first response. Whenever something really traumatic happens, our first instinct is to deny the existence of this thing. It brings us comfort and is often the first reaction. This can be like somebody who just got their first exam and they failed the exam. Their first reaction would be denial. For example, not believing that the results are true and believing that there was a mistake somewhere. The second stage is often anger. And this can be akin to being angry that the results are false, being angry at themselves, being angry at the school that they just took the exam in. And after anger comes bargaining. And this is especially true in cases where the bad news were given to someone by another person. For example, if they were in a hospital and a patient was talking to the doctor, and the doctor told the patient that their loved one got a terminal disease. At this stage, the patient would start the bargaining process. Like saying, what if we, for example, took her lungs out if she had lung cancer? Or what if we gave her chemotherapy or radiotherapy? They would start exploring their options. And then comes grieving. At this part, the patient can be exceptionally sad and sort of depressed. After grieving comes acceptance. We would accept that this is actually happening, we would accept the situation and the options. Again, everybody reacts differently to trauma or bad news, but these are generally the main pillars or main chapters that we go through. In psychology and psychiatry, these are called the stages of grief. Use the link below to get access to the full mnemonics course. In this course, we will discuss all the important high-yield topics that we see everywhere in the clinical practice. These topics are especially important for healthcare providers. We cover topics like the treatment of acute heart failure, tension pneumothorax, and other